Hello everyone, welcome back to my YouTube channel Online Psychology. Today in this video I'm going to talk about the treatment of mental health disorders, but this is a very vast topic and it can't be covered in this video, and I'm going to be making new videos and we're going to talk about interesting therapy techniques and much more that you would be interested in. So for that you have to subscribe to my channel and press the bell icon so that you can receive those videos. So today I'm going to start giving you the basics of psychological treatment. Obviously you can't just go to grade 10th without studying kindergarten, right? So you need to know the basics. So the first thing that we're going to talk about today is that when to seek treatment. All of us, we face many problems in our lives. We feel stressed, we feel anxious, right? So we try to overcome those things by ourselves, but sometimes we're unable, right? There are two things. If your mental health problem, your symptom, whatever thing that is bothering you is consistent, and second thing, if it is significantly disturbing your life, it's causing significant distress in your life, any aspect of your life, like your school life, your work life, your social life, your family life, your marriage life, whatever, right? Any aspect of your life is significantly distressed, then you have to seek help from a professional. Now, who can help you? Either a clinical psychologist or a psychiatrist. Now, who are they? Clinical psychologists like me, they have at least 6 years education and training in clinical psychology. They are specialized to perform psychological assessment, make a diagnosis, and provide you treatment for mental health problems. And psychiatrists, they can prescribe you medication. So I'm going to talk about the psychologist thing, right? Because I'm a psychologist, so I'm not going to talk about the psychiatry thing here. So now, what will happen, how it all starts, how the treatment starts when you go to a psychologist, what happens? In the first session, it would take around 45 to 90 minutes, and the psychologist would interview you, and they would want to know that why you came, what's the purpose of your visit, what are the symptoms, what is bothering you. They would even sometimes want to talk to a partner or a family member, right? And this will be an in-depth history-taking session, because your diagnosis and treatment depends a lot on this. This is part of your psychological assessment, right? Then they would formulate a diagnosis, a tentative diagnosis, and then they would formulate a treatment plan. The number of sessions that would be required for you, and the therapy techniques that would be required, the goals of the therapy, and the maintenance sessions or follow-up sessions. They would plan everything. They would plan every session and everything, and they would make the treatment plans. And you would normally visit a clinical psychologist as an outpatient. You would go into the OPD and visit your psychologist. But sometimes if a patient is a threat to themselves or to someone, or for example they want to kill someone, or they want to set fire on a building, then obviously they would be hospitalized. So this was a little bit about the treatment of psychological disorders. In the next videos you will learn a lot more interesting things about this, so please subscribe and press the bell icon as well. Thank you.